First, I'm going to be suctioning my patient. And before I do anything, I'm going to verify my physician orders. And I'm going to go into my patient's room, knock on the door, introduce myself. And I'm going to use 2 identifiers by using an armband. And then I'm going to explain the procedure. And then I will wash my hands before I start anything. So after I wash my hands, I'm going to gather my supplies. I will make sure it's up to date and intact. And after I do that, I'm going to get everything out. Make sure I don't drop my hands below my waist. And I'm going to open it. And before I done my sterile gloves on, I can go ahead and get this little cup thing out. I'm going to sit it right here. And I will lift this. Never mind. And I will pour that in there. And I'm going to go ahead and open this up. It is backwards, but it's okay. We're going to flip it. Oh gosh. Oh gosh. So I'm going to step back and put on my sterile gloves. And step back and put the other one on. Oh gosh. That we got it on. And I will hyperoxygenate my patient before I suction and do anything. I will hyperoxygenate for at least 30 seconds, no more than 3 minutes. And after I do that, at that amount of time, I would go ahead. Alright, I poured the water in the cup for my test the system. I'm gonna have a clean hand, a dirty hand. This is gonna be my dirty hand, and this is gonna be my clean hand. And I'm gonna go ahead and get my catheter out. And I'm gonna get it out with my clean hand. And I'm gonna hook this up. This is my dirty hand, so I can touch this part. And I will hook this up to the suction thing. In real life, it will be one and it will fit. But for right now, I will hook it up. And this is my clean hand. I will test the system and it's working. And after I would do it intermittently. And after I test it, it is working. I'm going to now go ahead and apply my suctioning into my patient's trach. And I'm going to not put it till I feel resistance, but I'm going to do it until like the point where the patient coughs. And I'm going to suction for between 10, I'm gonna do it intermittently, and I'm gonna suction for no less than 10 to 15 seconds. And after I do that, I would take it out and I'll put it back in the sterile water and do it intermittently. And then I will hyperoxygenate, but since I'm doing it one time, I would hyperoxygenate 3 seconds or 3 minutes. And then I would dispose of this in the bio bag and throw everything else away in the bio bag. And I would make sure that my patient is in a comfortable position. Call bed within reach, bed lowest position, side rails up ×2. And I will go document